Hello everyone, this is Dr. Divyia, Specialist Pediatric Dentist at Clover Medical Centre. Here we do specialty treatment for both kids and for adolescents. Today I'm here with you to discuss something regarding a medical emergency condition. How well you can act or how can you manage if your child's front tooth gets knocked off from its socket. Medically we call this as an avulsed tooth condition. Suppose your child is playing on the ground and if he or she tends to fall from a height, say from a staircase or from a ladder or from a bicycle, what happens is that he tends to hit his face directly on the floor with so much force that his front tooth has high chances that it will just get knocked off. It just gets pulled off out of its socket and tends to get lost. So you as a parent or a caretaker, you tend to get so panicky at the time because his mouth and teeth and lips and all will be covered with so much blood and you would really not know what to do at that time. So here are some tips of how to manage such a panicky situation. Alright, so tip number 1. Call out for help and immediately rush the child to a hospital or to a clinic. Number 2, never leave the situation or never leave the scene without finding the lost tooth. It will be either hooked up in the child's own dress or you can find it at some distance from where the child has fallen. But always make sure that you get the teeth back, because only if you find it, only then your clinician will be able to replace it back and restore it into the arch so that your child will get his normal smile back. So it's very important to get it back. Alright. Now the third point is, once you get the teeth back, you are not supposed to scrub it and clean it so thoroughly. You might do it with an intention of just cleaning the tooth, but never scrub the tooth either with a soap or with a detergent or with a disinfectant or anything of that matter. Okay, always be careful that you hold the tooth by the crown and then clean it with a low running force of tap water onto it. Just that much. You need not be careful that you hold the tooth by the crown and then clean it with a low running force of tap water onto it. Just that much. You need not over disturb the tooth. Alright, be careful on that matter. Now, once the cleaning is done, how will you transport it? You can transport it in a container with a solution. What solution to use? Never dry it or pack it in a piece of cotton, cloth or piece of paper or anything. You can just put it in a container with a solution. What solution to use? You can use normal bottled pasteurized milk, which is readily available at your all homes. If milk is also not available, what you can do is you can just collect some of the child's own saliva and store it in it and take it to the clinic. Okay, so that will also work well in such a situation. So be careful about the transfer of the teeth. Now, the faster you reach the clinic, the better the results you get. The best results you get if you reach the clinic in less than half an hour. But more than 2 hours of time you take, your results are also likely to be highly compromised. So once you get back to your clinic, your clinician there will clean the tooth with few other medicated solutions and he will replace the tooth back into the socket and stabilize it with something called as splinting, and he'll give you few instructions of with few medications and with a soft diet. Within 2 or 3 weeks of time, you should be really able to get back to your normal smile back. Alright, so what you have to be careful about is that you have to act fast and smart without wasting any time. You have to get to the clinic as soon as possible so that the clinician will help you replace back your tooth on time. Alright, so follow the tips, do not be panicky, act fast and smart. Alright, so take care. Now for any questions or any doubts that you have on this, you can feel free to call me at any of the Clover Medical Centre branches that we have in Tekom, in Bardubai, in Mirdif and in Al Nada. So take care and follow the tips. Alright, bye.